Hello, everyone. Thank you for joining us today for this month's Cybersecurity Insider Program webinar. The topic today is the changing landscape of cybersecurity accountability in healthcare. And joining us today to present the information to you is Kelly Watson from CloudWave. She's our Director of Product Management, and Guy McAllister, Principal Cybersecurity Advisor and also a former hospital CIO. I'm Laura Hursley, Marketing Director, and I'll be moderating today. If you do have questions throughout the webinar, please enter them in the questions pane of your control panel, and we will get to those at the end of the webinar. So now I'll turn it over to Kelly to get us started.
Great, thanks, Laura. So good afternoon, or maybe morning, depending on where you're calling in from, but thank you for taking the time to join us today. We are going to cover, as Laura mentioned, the changing landscape of cybersecurity liability and really get into some discussions around accountability. And as we all understand, the increasing prevalence of cyber threats has significantly impacted the healthcare industry, where the protection of sensitive patient data is, paramount. In recent years, the landscape of cybersecurity accountability has evolved with greater emphasis on the role and responsibility of the C-suite in safeguarding the information. So today we're going to discuss and focus in on some trends, some accountability, the impact of breaches, and hopefully some things that you guys can you can consider and learn from today. So as mentioned, cybersecurity threats in healthcare have grown in both frequency and sophistication. Cyber criminals are targeting healthcare organizations, due to the valuable nature of patient data, which can be exploited for identity theft, financial fraud, and other malicious activities. Common, cybersecurity threats include obviously ransomware, phishing attacks, data breaches, and each posing significant risk to patient privacy and organizational stability. So statistics reveal, obviously the alarming scope of these threats, and we understand that they're still continuing. So for over the past 10 years, we have seen this upwards trend for the number of breaches in healthcare, and you'll see a slight decrease there in 2023, and while that seems a little bit hopeful, unfortunately, as you see on the other graph to the right here with patient records, is that the amount of the patient records being exposed has reached an all-time high. So from 2022 to 2023, it has almost doubled, and we've seen about approximately 110 million patient records being exposed. And what this is telling us is, though, that although the attacks may have slightly decreased, the types of targeted attacks and the exposure of the patient-sensitive data is becoming more severe and prevalent. And all of this is coming again at the hefty price tag for healthcare organizations. In 2023, the average cost to recover from a breach was just under $10 million, and we've seen exponential changes in the amounts that it is costing organizations as we continue here in 2024 and forward. So, accountability. When a company, discovers that there is a cyber attack on its network, we see often that the blame game often follows. The CEO may point fingers at the CISO, while the CISO might argue that financial officers failed to allocate sufficient funds for cybersecurity measures, or the CIO might shift the blame down the chain and possibly fire or reprimand a lower level employee who made a mistake, or highlighting a vulnerability in third-party vendor security. And if the incident involves, the cloud, the question arises, is it the cloud provider or is it the data owner responsibility? So while the blame game, may be passed around, legal liability is inevitable. But who holds that responsibility? Is it a single individual? Is it a specific department? Or is it a company as a whole? And when we talk to the C-suite, or even most people outside of IT, and you ask who is responsible for handling and really truly dealing with an incident and the incident response due to a cyber attack, about 90% of a hospital organization would say that IT owns incident response, and then the rest of it is really just kind of operational. when you think about a cyber attack, traditionally people are thinking about computers have been attacked. So, hey, that's the IT's responsibility. And what we've been finding is really quite the opposite of that. It's not the IT alone. It is, lead departments in hospitals that are responsible for responding to an incident. IT, we would say, has about maybe 10% of the responsibility, which is mostly focused in on getting the systems back up. But in reality, the priority is that we need to focus on patient safety, and that is everyone's responsibility. So some of the trends that we're seeing, is this change of where incident response is becoming more patient-centric. So we're not worrying so much about how fast we get the systems up, and not to say that it's not important and that we still have to prepare on getting the systems up and determining how we are going to recover, but we've just shifted the thinking to, are patients going to be impacted by this event, and how do we prioritize the patient first? And traditionally, I think that we've, kind of failed as an industry in the sense that we've failed to really focus in on patient safety from a cybersecurity perspective. And that's probably just a, creature of habit in the way that we've been taught, and we've accepted this for long periods of time, where HIPAA has nothing to do with patient safety, but it speaks to just patient data. And again, it could be, argued that a lot of the frameworks that rely on that, so NIST CSF or 853, they're all focused in on the data and not about patient safety. And there's a study that came out in 2016 about the impact a cybersecurity event has on patients during an event, and I'll talk about that shortly. But what we have seen, again, over the past several months is this shift occurring to focus in on the patient versus the data. And where we've seen this kind of shift is with tabletops. We used to see a lot of IT-focused tabletops, but we're not seeing that as much anymore. Typically, we understand that IT knows what they're doing. So we've seen where organizations are really looking to focus in and have more of that clinical and executive types of tabletops. And during these tabletops, we take the element out of the IT focus and say, hey, let's just assume that IT knows what they're doing. And we're going to focus in on everybody else. And does everybody else truly understand what their roles are when it comes to dealing with a cybersecurity event? This helps align everyone in your organization, from finance people to operations to your clinical staff, understanding the impact to patient safety, and how does your organization prioritize your response to ensure that there is truly no impact to the patient. And we've learned a lot from conducting these tabletops. We've learned that purchasing systems need to be up and running, that command centers start to fall apart rather quickly. There's operational issues. And most recently, we had the opportunity to participate in a Muse event where there was an organization where we got firsthand kind of lessons learned from what they had just recently had experienced a breach. And they shared, a lot around maybe what organizations might not think of when you're dealing with downtime or prolonged periods of downtime, and when you have to move to paper. Some of your staff may have never written to paper. So you have, a mixture of, staff within your organization that may have been at the organization for 25 plus years, and nurses and clinical staff that, hey, they embrace going to paper because they understand it, while you have others that maybe have just recently graduated and they have really no idea how to write to paper. They've never experienced, what do they need to, what do they need to contribute to having a paper system, and how do they manage all of that? And how you as an organization are educating them is important to understand. They also shared that even if you have paper, maybe those have been sitting on the shelf somewhere and that they're outdated and they don't actually have enough of the paper, so they have to spend time getting copies. And some staff members, again, maybe are willing to help educate, but it takes a lot of that to do in the midst of while you're dealing with an incident. And you need to be prepared prior to an incident versus just kind of figuring it out during the time of an incident.
Laura,
go ahead.
I just wanted to point out too, with going to paper and downtime procedures, if you're an organization that has a fairly healthy informatics department, your informaticists will be a great tool to help those learning really how to move away from a computer and how to go to paper. It needs to be a process that's practiced repeatedly. And I just want to point out too, Kelly, to your point earlier about the importance of prioritizing patient safety during an attack. And Kelly, you alluded to the tabletops and how important they are. But even if you're a hospital being surveyed periodically by Joint Commission, even Joint Commission has come out last year with a Sentinel Event Alert 67, which is preserving patient safety after a cyber attack. So even Joint Commission recognizes that there is a threat to the patient's livelihood, the ability to survive in the aftermath of a cyber attack. So tabletops and understanding these paper processes are so important, and they need to, the muscle memory needs to be ingrained in whether it's monthly, quarterly, but everyone needs to automatically know where to find the paper documents, how to use them, and how to continue to care for those patients.
Yep. Thank you, Guy. Yeah, and considering and continuing with on lessons learned, one of the I think eye-opening considerations that I've heard often in participating in tabletops is, and not often thought about, is med math. And so if you're losing all of your smart pumps, now you're in a position where the clinicals don't necessarily know how to do, they don't recall how to do paper-based mathematical calculations around your IV drips and dopamine infusions and other things. So now you're struggling with that as well, and that becomes a bigger issue. And all of this has an impact on patient safety. And again, this is not just IT focused, and it's not just an IT focused response. Another thing, and maybe this is, something unsettling for some, but the time is coming where we really need to think about IT security moving out of the IT organization. So it's been talked about for several years, and as new regulations are being evaluated and as events continue to emerge, and I'll talk about some case studies here in a moment, this may change how organizations actually think about where IT should be reporting. And also thinking about who holds the CISO title and the responsibility of the CISO position, and should you separate this out from IT? And I believe this will continue to be much more of a serious question and conversation, regardless of the size of your organization that you come from. Next, we also see some changes around relying on maturity models. So instead of your traditional assessment. So the reason that we find that these are extremely effective instead of relying on your traditional HIPAA assessments or NIST CSF assessments is because using maturity models, it's really being used for compliance, and having the ability to articulate to your C-suite and your organization as a whole, how are you in your security maturity, and helps you to identify where you have gaps. So the maturity model allows you to have discussions with both your technical and your non-technical team members, and really getting everybody on the same page of how do you prioritize security as you move forward. So there was also something for those who might not have been familiar with this, and where I think that we really need to recognize that, we're still behind the times, because this study was completed in 2016, and this is known as the Vanderbilt study. And basically what happened is during, I think it was 2012 to 2016, Vanderbilt University looked at significant cyber events in the healthcare space. Most of these were ransomware attacks, but when we say significant, we define that word as, any type of attack that disrupts hospital operations for any reason. It doesn't mean where you have to, shut the hospital down or you have to go to paper, but there is an impact. And what they found during the study is that during any type of significant cybersecurity event, one that impacts normal operations, there's an increase in patient mortality. And now, why is this? So it might not be what you're thinking. It's not due to the systems being brought offline or medical devices were compromised. The reason why patient safety is impacted is simply because the caregivers become distracted and they start worrying about the attack. So there's this emotional concern and psychological response to a cyber attack that happens. And really what happens is your staff are not focused on caring for your patients. So your clinicians, your nurses are worrying about how are we dealing with the cyber attack. They start figuring or thinking, I guess, about what type of impact does it have to me? Maybe my financial data has been compromised. Maybe my personal data has been compromised. And what happens is even when your systems maybe, come back online is that your clinical staff may start to lose trust in the actual systems themselves. So is it showing me the right data? Can I trust the data that I'm looking at right now is actually accurate and true? And what we've seen, unfortunately, is the outcomes of these types of attacks we're starting to see is lawsuits. And this one was a pretty well-known one. And this attack occurred in 2019 in Alabama. And the plaintiff alleged that the hospital did not have the appropriate training, systems, protocols, practices in place to respond to a cyber attack, and that their staff was distracted. And because of the staff being distracted, they neglected to care for a newborn, and tragically, the newborn had died. And in this lawsuit, the mother of the newborn brought the suit against the hospital as well, not just for the distraction of the staff, but stating that she was also never informed that the attack was happening at the time that she was admitted. So had she actually been informed, she would have made a decision differently that, hey, you guys are under attack. I actually don't want to admit myself to this hospital right now. And she believes, and her attorney believes, if she would have gone to another location, that her child would have lived. So we're living in a different world, regardless of the fact if you're a small hospital, critical access rural hospital, community hospital, or health system, large health system. Everyone needs to take pause, regardless if you're the C-suite, a board member. Everyone really needs to be prepared. So showcasing, some of the, case studies and in today's rapidly changing legal landscape, companies are, confronted with a litany of cybersecurity issues, both domestic and international. And what's really rising to the top is the liability from the CIO and the CISO cybersecurity liability and how they're being held accountable. So speaking to some of these, the SEC had charged SolarWinds Corporation and its CISO with fraud and internal control failures related to known cybersecurity risks. The CISO, despite being aware of the known cybersecurity vulnerabilities, allegedly failed to act and escalate them appropriately. And the SEC claims that the SolarWinds and the CISO violated anti-fraud laws by overstating their cybersecurity controls and withholding information from investors. There's also another significant case, which was the Premier Blue Cross data breach, which exposed personal information of approximately 11 million individuals. The legal consequences included, I think, it's about a $74 million settlement and multiple regulatory fines. This incident highlighted deficiencies in, their cybersecurity measures and raised questions about the role of its executives and in overseeing the data protection. It also reinforced the need for C-suite leaders to be actively involved in really understanding the cybersecurity governance and strategy their organizations have. And additionally, we've seen high-profile incidents such as Universal Health, Scripps Health ransomware, and Change Health have all led to significant operational disruptions and patient care delays and have resulted in multiple lawsuits and regulatory actions targeting the C-suite. And we believe that these lawsuits are going to continue to evolve, and we're going to see more of them. What we're seeing now is even this 18-month aftermath, we're seeing class action lawsuits. Attorneys realize that there's opportunities to go after these hospitals, whenever there has been an attack. And we all know that breaches are published as part of the OCR reporting process. So finding out who has been attacked is not that hard. And when, you know, law firms get this information, they are sometimes going directly to the patients and asking, hey, you know, I noticed that you had stayed in this hospital during this period of time when this attack occurred. And they're very crafty in the way that they ask questions to patients, and they'll say, you know, do you feel that your patient care was impacted during this time when you were in the hospital when this event occurred? And most people will say, well, yes, I did kind of feel that there was an impact. There was a lot of disruptions and there was a lot of chaos that was happening. And from that, they'll start to build class action suits, which becomes very challenging. And we highlight these not really meant to scare anyone, but really emphasize that these cases, you know, there's importance of having proactive cybersecurity measures and understanding the severe consequences of negligence, and further illustrating that there's a growing trend of executive accountability. And more CISOs and potentially CIOs will be personally accused for their actions and maybe their inactions, and prior to and during cyber events, and personally named as parties in lawsuits. So traditionally, you know, when cybersecurity was considered, you know, the domain of IT departments, again, that there's this increasing complexity and stakes of cyber threats that have shifted to the C-suites. Executives are being held accountable for their organization's cybersecurity posture. Previously, companies could have kept maybe their cyber incidents and data breaches under the radar and away from the public eye. But with the advancements in regulations and public sentiment and the nature of cyber attacks, all of that has changed. So we recognize that, you know, organizations need to foster a culture of security awareness and ensuring that cybersecurity is prioritized at that strategic level. You know, you really want to be promoting a culture where cybersecurity is everyone's responsibility, and regularly communicate the importance to cybersecurity to all staff levels. You know, the C-suite and the board members must take an active role in evaluating the company's cybersecurity posture and strategy. They also need to have clear and updated understanding of the organization's security. And, you know, this includes, you know, understanding their resources and their staffing levels and training, and how are we training, and understanding the systems and procedures, and, you know, what are we doing when there is an incident response, and business continuity needs to be taken into account as well.
And Kelly, it is so important too for the IT leadership to be able to have a relationship with the C-suite, with the CEO, with the CFO, to have a relationship with the board, so that there is an open line of communication. It also, I think, is important as IT leaders, while we're shifting responsibilities away more from IT and more to the senior leadership level, it still has an IT ring to it always, because it's cybersecurity. But that means as IT leaders, whether you're an IT director in your organization, or a CIO or a CISO, it's your job to also know the business of your hospital. And by that, I mean, understand those concerns that your CEO has and your CFO has, and work with them as well, because often we in IT, you know, exclude ourselves from that mindset, and we're just focused on servers and data and network, and it really begs us to become more of a partner with them, so that they can trust us as IT leaders, and being a partner with them as well. And that's where you can expand to all of the front line. Everyone then has a role and a responsibility in security awareness, because if your board doesn't get it and your senior leadership doesn't get it, the doctors, nurses, the med techs, all the rest of them won't get it either.
And so, yeah, with all of the responsibility and the changes, you know, sometimes we hear that there's, you know, key challenges that the executives of all types within an organization are often trying to figure out how much cybersecurity is enough, and how much investment do I need to make. And really what, Guy just said is that partnership with your IT team is, at times that this is, this type of question of how much do I need to invest is maybe left to the IT team, and we ask them to come up with some sort of strategy, but it really is that partnership that it shouldn't just be left up to the IT teams to decide, or their leadership. It really needs to be involving everybody. It's not just about implementing the latest and greatest tools and technologies. It's walking that fine line of how much cybersecurity do you need, and how do you get your organization to feel that the funding you're providing is really appropriate. So some things that you can consider and start thinking about is, have you ever done anything that, to reduce liability and more importantly, to reduce liability and more importantly, increase defensibility? So when we talk about defensibility here, we really mean legal defensibility. So is the ability to defend yourself after an attack has occurred and you're now faced with a civil suit, or OCR is coming after you, or a state attorney general office is looking at you because, somebody died and they shouldn't have died. Because you didn't have that appropriate investments, they weren't made to obtain the right technologies or the practices or the training in order to assure that you've done everything possible to minimize your risk. So ultimately questioning, how have we as an organization reduced cybersecurity liability, and how have we increased defensibility? And this is not something that you can just pass on to cyber insurance. Your cyber insurer cannot protect you from a civil suit or state attorney investigations. You need to just keep that in mind, that cyber liability insurance is only going to get you so far. And in reality, if you can't demonstrate how you as an organization are reducing liability and increasing defensibility, your insurance premiums are going to be pretty astronomical. As we all know, that they've gotten really expensive, and it's, they've gotten really, wise to the challenges of insuring the healthcare sector. So while you might not be able to avoid being sued, the question becomes, what do you need to do in order to help prevent you from, being judged liable once you are sued?
And Kelly, that is such an important point that you just made in how we can increase our defensibility. And you can do that by looking at best practices. And those best practices that are out there, whether they're NIST, CSF, or 853, or high tech, you need to look at those best practices and see how closely you are following them, and then strive to follow one of those best practices. And what I would say too is document, because if it's not documented, if it's just ad hoc, you're really not following best practices. So it's an opportunity to determine what framework you want to follow as best practice, and document it and keep it on record as to how you're achieving this.
Okay, and so we also have something, for those of you maybe have not heard this before, we have something called the deposition test. And really this is something that we thought of, and something for everybody to consider. And what this really means is that whenever you're making a decision in terms of your cybersecurity strategy as leaders of your organization, especially when you're thinking about the financial investments you're making or not making, or if you have the right tools or software, one way for you to determine if this is the right investment or not is by imagining yourself in a deposition. So imagine if you've been subpoenaed, or imagine that a nurse or one of the IT team members have been subpoenaed, and they're being asked, by an attorney about your cybersecurity strategy, and what was invested, what was purchased, were there things that you should have done but you didn't do? What if your policies and procedures were subpoenaed? So aligning with what Guy just said is make sure that you're adhering to the best practices and policies and procedures. But what if your pen tests, and hopefully that you're doing pen tests, but what happens if those were subpoenaed? So you need to consider when all of this is when all of this information is reviewed, and people are scrutinizing this, and they find out, hey, it turns out maybe you weren't patching because you didn't have the people to do that, or we just plainly didn't invest in patching, or we haven't updated our policies for 3 years, or hey, we just go through a traditional HIPAA assessment. We've been using the same group for the past, few years, and they seemed like they knew what we were doing, but now, hey, we just discovered that all of our, policies and procedures were outdated. So hopefully the deposition, doesn't happen. And then that case that I was talking about earlier, the Alabama case, I believe that they had settled because, they didn't want to go to open court and face all of these questions and then really have that part of the public record. So you can use the deposition test as a tool to help you determine what are you willing to deal with or, not, and what is really an appropriate defense. So there's a good chance that you will be deposed after an incident, given the increase in lawsuits that we have discussed. So this is one good way to, think about what happens when you are deposed. Another key item to consider is really determining your risk tolerance. And this can be a very deep topic, but I'll just touch on it, high level here. But as an organization, you need to be able to determine what is your risk tolerance from a cybersecurity perspective. Do you want very low risk? Obviously, the lower the risk, then you are willing to tolerate the higher investment. If you believe you're going to take on a high risk, chances are then you will have lower the investment. Your risk tolerance will not only help you determine your level of investment, but it will also help with your level of impact and your sophistication. So you need to understand, what level of impact you're willing to take if your organization is affected by a significant event, as well as, understanding your level of technical sophistication and practices that you need to put in place. So the level of investment, impact, and sophistication will be driven by your risk tolerance. And you might be thinking, hey, why do I have to determine my risk tolerance? But having this in place really does help support what we just talked about, is that defensibility. So if you are deposed and you might be asked, well, how did you determine that your level of investment for your cybersecurity strategy was appropriate? You should be able to answer that. And you can say, hey, well, one thing that we did as an organization is that we've, determined our risk tolerance, and our risk tolerance is based off of these factors. So again, it's, something to consider to help build that defensibility strategy.
And Kelly, if I could add, with risk tolerance, this is a process that needs to be looked at without the pressure of a cybersecurity event occurring. That's not when you determine what your risk tolerance is. And it's also an exercise that needs to involve senior leadership, IT, clinical, patient care groups, because that risk tolerance is an organizational risk tolerance. It's not what IT determines is the risk tolerance. Any more than just the CFO or finance determines what's that risk tolerance. So it is a great exercise in bringing all of the right stakeholders together to try to determine how much is too much, how much can we live with, and everyone come away with an acceptable risk tolerance for the organization.
For those of you who may be not aware of this, there is an executive law that was signed on January 5th, I think 2021, and then it's still in effect. It's called HR 7898, and one of the things for you to know about this is that it states that HHS has to take into consideration and reduce fines if your organization has made the appropriate investments in cybersecurity. So this is a good thing if, because you are reducing potential liability if you can invest appropriately. On the other hand, if you don't and you can't take advantage of this and you get breached, that does send a clear signal that you're not doing the right things, and then you're getting a higher level of fines imposed on you because OCR found out that, hey, you're not doing everything that you could be doing to protect the organization.
And this bill also, Kelly points out, as we talked earlier, the need for best practices and documentation. You've got to show that from the incident past in the background, looking backwards, that you are following best practice that was identified and that it's documented as such. So it just points out the importance of what framework do you want to follow as a best practice, and how are you going to document the evidence that says you are following that.
So the regulatory landscape, governing healthcare cybersecurity has, continues to become, increasingly stringent. Key regulations that we are all familiar with is HIPAA and high tech, that they mandate strict data protection and privacy standards. And these regulations have shifted responsibility and have evolved to a place of greater responsibility on the organizations. Executives are now expected to ensure compliance with cybersecurity standards and implement robust measures. Also, you have the GDPR, further exemplifies this trend with its, stringent data protection requirements and significant fines for non-compliance. There's also the National Cybersecurity Strategy Framework that seeks to protect critical infrastructure, including hospitals, from cyber threats. And in this strategy, there is also the position that ransomware is a threat to national security, public safety, and economic prosperity, and that businesses should not pay ransoms in an effort to reduce the potential for profit of ransomware schemes. So we're not telling you to or do not pay ransomware, but it is something that you need to consider and have that decision made prior to, dealing with a ransomware event. As mentioned, that we had recently participated in a Muse event, and there was an organization that was discussing paying ransomware, and the FBI stated clearly that if an organization pays ransomware, they are automatically placed on the terrorist watch list because they are considered to be funding terrorism. So it's something that you need to think about and have those open discussions about ransomware as well. And pretty much all of these, regulations and cybersecurity and your cybersecurity practices have been focused in on protecting the data and not the patient. But we have again seen that shift, and there's these trends from organizations and regulatory bodies that are focusing to be, from the data to become more patient-centric focused. We know that HHS is working with Congress to put plans in place to incentivize hospitals to implement best practice cybersecurity practices, greater enforcement and accountability. And for those of you that have, participated on these calls before, we had a presentation of HHS healthcare and public health cybersecurity performance goals back in February. So in case you missed it, you might want to revisit that webinar for some additional information on that as well. We also see that there's some state-specific initiatives. For instance, New York State has proposed regulations requiring state-licensed hospitals to establish robust cybersecurity programs. And these regulations really focus in on the policies, the personnel, the risk assessments, and the incident response plans. And strengthening, protections for hospital networks and systems is essential for patient care, and it complements existing, rules like HIPAA. And, to help with healthcare organizations addressing with the, growing patient safety concerns, Guy had already talked a little bit about this, that the Joint Commission has issued the Sentinel Event Alert 67, which focuses in on risk associated with cyber attacks and provides some recommendations on how healthcare organizations can prepare to deliver safe patient care in the event of a cyber attack. So we encourage you to, do your own research on this and find out some additional information, because we do see a stronger interest in focusing in on patient safety and knowing what you're supposed to do prior to an event versus reacting while you're faced with an event is critical. So to help with organizations and fostering where we've continued to see the drive towards patient-centric understanding, we do have this patient-centric IR program. We encourage you to request our white paper and review the patient-centric incident response webinar that we had completed. This provides the guidance on IR and steps for how organizations can continue to have that patient-centric mindset when developing your procedures, your plans, your education, your training and awareness. So this is another additional, resource for you to start helping guide you on what does it mean to be patient-centric focused. I guess, ways for you to start thinking about, best practices and how do we combat these attacks. Companies, obviously, and organizations must develop a cybersecurity culture and formulate initiatives to protect their organizations. So investing in, advanced security technologies, implementing your state-of-art security solutions, such as your intrusion detection systems, encryptions, and multi-factor authentication. Staying updated with the latest security trends and technologies is important. Ensuring that your cybersecurity policies are current and aligned with the latest regulatory requirements and industry best practices. Conducting regular training and awareness for your employees, as well as conducting maturity model assessments, performing risk assessments to help you identify your vulnerabilities and encourage you to address them proactively. Engage third-party experts to conduct independent audits and as well as pen testing. Have comprehensive incident response plans in place that includes your protocols for communication, your data recovery, your legal considerations, and ensure that you're testing and updating your plan to ensure the effectiveness of an actual, your effectiveness during an actual incident. As we talked about earlier, having your tabletop simulations is a great way for organizations to really put their plans to kind of put the paper to the, figuring out what you're doing. Is that going to actually truly hold up, and are you secure, and are you ready for a tabletop event and or an incident? And practicing these tabletops are extremely important and eye-opening, and getting best practices and knowing maybe where you have these gaps. Fostering collaboration across departments. Ensure that cybersecurity is integrated into all of your business processes and all of your decisions. And facilitating that collaboration between your IT teams, your legal, compliance, and other relevant departments. And as mentioned, really determining your risk tolerance and understanding your level of investment so you can increase your chances of defensibility. And maintaining open communication with regulatory bodies, to stay informed about changes and expectations. You can participate in, industry groups and forums to share knowledge and learn from your peers as well. So, overall, we've seen that, the changing landscape of cybersecurity accountability is placing greater responsibility on your C-suite to protect, sensitive patient data and maintain that organizational resilience. With the evolving threat landscape, you have, stringent regulatory environment and severe consequences of cybersecurity failures. Really underscore the need for executive involvement in your cybersecurity governance. And hopefully by adopting proactive measures and fostering a culture of security, healthcare leaders can effectively safeguard their organizations and uphold their accountability in the face of cybersecurity threats. So with that, we just kind of want to have a reminder that we have another insider program that is being offered in September. And in the September, the topic is going to be virtual attack. And then in October, we have a cybersecurity, which is the Cybersecurity Awareness Month, a conversation about pen testing with Hector Monseguer. So hopefully, if you haven't already registered, please make sure that you are, registered and encourage others to register as well. So we thank you for your time today. I'm not sure, Laura, if there is any questions, but again, we thank you for taking the time to listen, and we hope that it was insightful and helpful.
I did have one question that came in. Is the C-suite liability issue in cybersecurity something that is also extending to EHR transitions and management? I don't know, Guy, if you have insight into that from a former CIO perspective, or know what that question is.
I would assume that today, right now, we're in a state of flux from an IT standpoint, where whether it's EHR, whether it's cybersecurity, pretty much it depends on the size, complexity, and makeup of the organization. It could be a precursor. It could also be one of those areas with EHRs where it's not the fit for everyone. I do think cybersecurity is much more open to all organizations. So I would say really it does depend on the organization itself. It has a place for that depending, and that's because of the clinical nature of EHRs, moving that responsibility to a team that's detached from IT, and IT itself then becoming focused on service delivery of data, aka networks, servers, infrastructure, those kinds of things. That may happen, but it's not a fit for everyone today. And that's just my opinion, by the way.
Okay, thank you, Guy. We don't have any other questions. Just a reminder that there is a link in the chat if you would like to download the patient-centric incident response white paper, and we'll also send that out in the follow-up email. And Kelly, any final thoughts?
No, thank you again.
Thanks, everyone.